gpTRAC here at ATA, highlighting some of the most interesting and innovative products. There's one off in the distance that's coming over to interview now. Slowly but surely.
More direct sales. We like that.
Well, hello there.
And how are you?
Very well. Can you introduce yourself and the product that you are here representing?
I'd be delighted. I'm not a doctor, but I play one on this little device. I could be a doctor or a physician. My name is Byrne. I live in Vermont, and I work for a company called VGO Communications. And VGO makes this little device. I will do a little pirouette for you. I am a little ways away, and I can both see you and be seen by you. And I can talk to you and you can talk to me. And if I were a doctor and if you were a patient, I would be able to have a full interactive consultation or observation with you and ask you how you're doing. If you had some sutures, on your hip, I could look down and make sure your wound was healing okay. I could look up and make sure you're okay. If there was somebody else in the house, I could turn to that person and I could ask him a question. I could say hi to your nurse or hi to your mother or daughter or whoever else was with you. And then I could do a full consultation. I can ask you how you're doing. I can ask you about your pain. I can ask you about your meds. I can answer questions you might have. If you're getting ready for a follow-up treatment, we can talk about what expectations you can have. And then I can go away. And what's nice about this is that if I'm away or if I'm too busy to make a house call, I can see you in your home environment. And this is becoming really helpful in terms of both making sure that the physician has his finger on the pulse, no pun intended, but also avoiding unnecessary use of emergency room visits caused really more by panic than by medical need, or unnecessary admissions, which are caused by people who feel that they're not doing well, and really by the time they come into the hospital, then have to be seen and sometimes kept for observation, even though they may be okay.
That's great. And now gpTRAC, or the Great Plains Telehealth Resource and Assistance Center, is located in Minnesota. Are there any of these units currently in Minnesota?
Yes, we have Mayo Clinic, which has bought a couple and which is studying how they might use it in a number of different rural health applications. And we have one actual rural health application in Minnesota where Virginia, the hospital in Virginia, Minnesota, which is about 3 hours northwest of Minneapolis, has bought one of these units to be able to facilitate patient interaction between the patients who are way north of Minneapolis and specialists or clinicians who are in short supply up north and who are going to be able to have a patient consultation or a patient visit without requiring the doctor to come up to Virginia or the patient to come down to Minneapolis, which saves a lot of time and a lot of money. And if the patient is sick, it saves a lot of wear and tear.
Well, we appreciate your time and wish you the best of luck here at ATA 2012. Thank you very much.
Thank you as well. Thank you for the visit.